Okay.
So you were talking about not falling for for sort of easy ways to deal with this, but you
Yeah.
also talked about age
Yeah.
and what happens to our microbiome with age, and how can we prevent it from sort of weakening? How can
Yeah.
we keep it strong? Does it get too late? Or I know there are people listening who are, and we've had questions from people who are in the 70s, I
Yeah.
think 60s, 70s, 80s. So how do we keep it healthy?
Yeah.
Is there any point where we just can't any longer do anything for it?
So the answer to that is unequivocally no. You can always do something. And in fact, there's lots of things that you can do. So just to give you like a broad understanding of what I think is happening is that as we age, we see changes in the ecology of the gut, and we see quite, consistent changes across populations. And we see changes in people that live for a very long time. So people that are known as centenarians, people who live over the age of 100, seem to have distinct microbiomes that have distinct functions that when you put them into animal models, lo and behold, the mice live for a longer time. Now, there are two broad things that's happening as we age. The first is that there's a process of inflammaging, which is, think about that like an accelerator, right? So generally, if your foot's on the gas, you're causing inadvertent harm through the process of inflammation. That furs your arteries, it causes obesity, it causes your risk of diabetes, amongst other things. But as we age, the foot comes off the accelerator a little bit, and you get something called immunosenescence. And what that means is that the immune system starts to slow. It starts to become less responsive. And what we know from studying the microbiomes of people that have been moved into care homes who are elderly, or who move into kind of environments with other older people, is that their microbiomes begin to homogenize. They begin to kind of become similar, and they lose their biodiversity, and they lose some of these critical functions, and that maps very closely onto how frail these people become and how their immune system responds to the aging process. So actually the key, I think, or one of the keys to it, is to ensure that you maintain the diversity of your microbiome as you age, and much of that remains actually in remaining social. So having physical connectivity with a diverse group of people. And many of our older populations are isolated and lonely and lack that, and that's very problematic. Clearly, maintaining your mobility is very, very important. As soon as you start to lose your mobility, your microbiome changes. And so actually maintaining activity is a key function of aging healthily. The third is obviously diet, as we've described. So having that diversity in your diet, maintaining the fiber in your diet, a little bit of fermented food, very, very good. But also, avoiding the bad stuff. And then in elderly people, again, it's thinking about things like polypharmacy. What that means is that as we get a bit older, we tend to have more health-related conditions for which we have to take more medicines. And all of these medicines are sometimes unnecessary, and we perhaps over-medicate our older people. And we want to try and get them off as many as we can, because it's really not very good for the bugs that live within us.
It's absolutely fascinating. I'm so delighted that your connection is better, because you're such a fountain of knowledge. And when you were disappearing, I thought we can't cope without you. But given that we have
sorry.
20 minutes more, and I'm just going to, my final question before, and we have got a lot of audience questions coming in, as I suspected. You say this is the century of the brain-gut axis. Freud would be delighted.
Yeah.
How can our increased knowledge of that relationship between the brain and the gut help us going forward? This sort of idea that there's so many, you talked about we're not growing happier, but how can our increasing knowledge of the connectivity between our gut and our brain and the mind-body connection, how can we use that, harness that to our benefit?
Well, it's a very early and exciting area of work. And we are every day something comes out and we learn a bit more about it. But I think philosophically, conceptually, it's really, really important, because it allows us to do two really important things. The first is ensure that our brains develop to their maximum healthy potential. And the second is to prevent them degenerating prematurely or causing some of the conditions that we commonly associate with aging, but perhaps, unfairly so. So Alzheimer's being a really good example of that. There might be a third, which is how we maintain our sense of happiness and how we maintain our mental health as we go about our day-to-day business. And to sort of break those three things down super, super quickly, and probably in a kind of oversimplified way. Number one is, if you don't have a healthy biodiverse gut microbiome, your brain simply cannot grow. It needs the energy, but it also relies on the microbiome to regulate its developing immune system. And that's very important in shaping how nerves link together and how you form some of the most fundamental parts of that kind of brain as it grows. And we know that when that process is perturbed, we can find things like symptoms of anxiety in young people, and we have a mechanism where we think that might occur. And we also have quite strong evidence now that the microbiome is very, very important part, and I say this very clearly, part of the process by which we think autism is caused in young people, right? So it's not the whole reason, it's just part of the story. In terms of mood, so if you look at people who suffer from depression, and just bear in mind the scale of the problem with depression. We have 16% of our population in the United Kingdom that take an antidepressant regularly. Like, we are really not happy. Again, the microbiome doesn't necessarily cause depression. There are lots of things in our lives that can do that. But we know that there are some of us that are unquestionably more susceptible to it. And again, we've got now targets within the microbiome that we can look at. And the really important bit about the microbiome is that you can do something to it. You can engineer it. You can take what we think are psychobiotics, so probiotics designed to target the gut-brain axis, or we can synthetically engineer it to switch on some of its gene functions, or we can give you more nutritional diet or dietary advices really targeted to help you as part of your kind of medical strategy. And then the third thing, as I mentioned, was in the degenerating brain. Like, you've probably heard a lot of excitement this week about Alzheimer's drugs coming into the market in the NHS. Yep. Those are super exciting. But what those drugs do is hold that condition at bay. They don't necessarily prevent it from occurring in the first place. And the microbiome is important because it gives us a different route to understand how Alzheimer's forms or how neurodegenerative conditions form. And it gives us a target that we can actually meaningfully leverage to prevent the disease in the first place.
Okay, so I'm going to reluctantly stop asking my own questions. That, there is just so much in this book that people can, but hopefully they will buy it and go and find out for themselves. But my last question to you, and it is my last question, is: you said you're an evangelist for the microbiome. You clearly are. Yeah. What are you most excited about in the sort of not too distant future? Yeah,
so we've spent the last 20 years working out who is there. And we're going to spend the next 20 working out what they're doing. And by the way, we really still don't know who is there. This book is called Dark Matter because not just because the microbiome dwarfs our human genome, and that actually 95 to 99% of the genes that we have floating around within us and on us are not human, and we have no working knowledge of them, right? So we've still got a lot to find out. Viruses, phage, I could talk for another whole hour on that. I won't. But we are starting to understand how some of these components work. And I'm really excited about new advances in our ability to target and engineer the microbiome to treat and really meaningfully prevent disease. And I'm also really excited that the microbiome is starting to come into the public psyche. It's starting to become a concept which isn't just quackery or stuff that is in a niche online, but actually will fill into mainstream policy, where actually we can say as a nation, actually we want to improve the resilience and health of our population by protecting our microbiomes and stopping the onslaught of ultra processed foods, drugs that we don't need, antibiotic misuse, and have a new framework for doing that. So yeah, I'm very optimistic about the future, and we can change the microbiome for the better. So that's a positive note to end on. That
I'm very glad that is how we like to end. Kate asks, and I'm delighted that she has, could you expand on psychobiotics? Should we be taking them, and if so, what types?
So the answer is the evidence for psychobiotics is purely experimental at the moment. What that means is it's largely come from animals and rat studies, and we have no good human trials that suggest that if you take a psychobiotic, you're going to definitely have your depression, treated, for example. There are particular strains and bugs that I've written about in my book, and you can read them, and there's all the studies are referenced there if you're really interested. But so I'm reluctant to say take a specific probiotic. But what I absolutely can tell you is that if you are struggling with these conditions, thinking about your health holistically and thinking about what you eat and put into your gut will have a really big impact on how the medicines that you take work to treat your antidepressant, to treat your depression. And it is very much part of the strategy of getting back towards, a positive mental health, a frame of mind. We do have experimental studies of fecal transplantation in mental health disorders. And the data around them is very, very early, and it's too soon to be saying anything definitive about it. But we've seen some very exciting work, for example, on the treatment of addiction. So addiction in both opiates, but also alcohol, things that are really destructive and destroy people's lives. When you reset the microbiome, you reset the gut-brain axis, you change not just how addictive those agents can become, but also, other kind of consequences of addiction, so your mood and how you feel. So I'm very optimistic about the microbiome as being a therapeutic target. I can't, as a clinician, say to you, okay, there are psychobiotics you can go to the market and take now. I think that's going to come in the next 5 to 10 years.
Okay. And Peter says, importantly, you said at the start, we did talk more about food, but we didn't probably cover this in the sense you said we should move away from the Western diet earlier on in our conversation. So Peter says, towards what?
Well, so a lot of the work that we've done in my lab, I've done in collaboration with the University of Pittsburgh and the University of Stellenbosch in South Africa. And what we're very interested in is studying, I'm a bowel cancer surgeon, right? So we're very interested in studying people who've got the highest risk of bowel cancer. And those with the highest risk are African-American men from North America, right? And then those with the lowest risk are actually rural sub-Saharan African populations that have a very, very high fiber diet. They are very lean, they exercise a great deal, and they're very in tune with their environmental microbiomes. So in our work, what we have done is we've kind of rather cruelly locked these two groups of individuals in a house and then crossed over their diets. And then we've controlled very precisely what they eat. So the African-American group get an African diet, and the African group get a North American diet. And then we've watched what happens to the microbiome and the consequences of that on the health of the gut. And the answer is that it's really dramatic, and it happens very, very quickly. So within 2 weeks, you can Africanize an American gut, and within 2 weeks, you can Americanize an African gut. And so to answer your question, what you should be doing is moving to, ideally, a very high fiber plant-based diet. So that's at least 30 grams of fiber a day. If you can increase just by 7 grams of fiber a day, your risk of cardiovascular disease, diabetes, bowel cancer, mental health problems, everything will drop. And if you can get to 50 grams, like a sub-Saharan African, you're an absolute champion. But you'll kind of blow up like a Zeppelin, I think. But
what sorts of foods should we be finding that sort of a level of fiber in?
Yeah. So what you want is mixed fibers. Fibers is not the word fiber is kind of misleading. It's not a very helpful term. It's not a single homogeneous food type, right? So fibers come in different types. We used to think about them as highly fermentable or low fermentable fiber types, but we also think about them as prebiotic fibers. So prebiotic fibers are fibers that bugs really like to eat to live off, right? And a lot of those come in fruits, and they come in, they do come in green vegetables and cruciferous vegetables, these sorts of things. And fibers that are non-digestible tend to come in roots of plants, and they tend to be, hard, crunchy things that are difficult to digest. Obviously, cereals, oats, fibers, these sorts of things are very, very important. There's another good source of them. And, to be honest with you, I don't really mind what you have as long as you're getting more of it, and it will do your health no end of good. But it is, as it fits with our kind of earlier part of our conversation, we know a lot of those fiber benefits are mediated through the microbiome, and we're beginning to understand how, and specifically which fibers and which bugs. So I think in the future, you'll end up with a very personalized, tailored strategy that says, okay, Hannah, you've got this problem, you need these fibers. It will select out these particular bugs, and this will have the desired health benefit, right? But I think there are a number of startups around the world trying to get us to that point. We're not quite there yet.
Yeah, it is very individualized. And I think people would say that, a lot of people have a lot of trouble digesting some of the things you've just said.
Exactly right. And my clinic is full of patients with irritable bowel syndrome that simply can't tolerate that. And the reason they can't tolerate it is that their microbiome is just not able to metabolize those fibers. It simply doesn't have the genes that it needs to switch on to do that work. there are a number of nutritional and dietary strategies out there that you will read about on the internet. One example is FODMAP. So these are, diets where you select out particular types of fiber to try and help retrain the gut. But again, if you're really struggling, I really, really recommend you reach out to a dietitian, either through your family doctor or online, because it's very, very helpful to have someone sit down with you, give you an actual menu plan, really actionable information that is specific to you. And we need more dietitians, I think.
Really interesting. So many questions. We started off talking about the pandemic and this sort of phobia. What misophobia is it?
Yeah.
Somebody asked, if there's another pandemic, would you advocate that we had another lockdown? I mean, I know this is a big question, and perhaps you can feel free to take the sort of pass card, but
no, I'm not going to take the pass card. It's a very fair question. I think so. Here's what I would say to that. I mean, lockdown. I think we're only really going to understand the true health consequences of lockdown in the years to come. I think the health consequences have been so significant, particularly for our mental health, particularly in our young, and it's going to take some time. What I absolutely know is in that first wave, and I know because I was in a hospital watching people die in very, very large numbers, that if we hadn't in that first wave, it would have been so much worse. I have absolutely no doubt about that. The second, third lockdown, that's more debatable. To come back to the microbiome, what I absolutely know is that those people who have a more diverse microbiome, both in their nose, in their upper airways, as well as in their gut, were much less likely to succumb to the most severe symptoms of COVID or to die from COVID. And we know that from studies across the world, and we've got good studies actually from sub-Saharan Africa. So if you go to sub-Saharan Africa, where they didn't have good healthcare prevention strategies, or at least they weren't perhaps as organized as they were in the developed world or in Europe, they of course had a catastrophe of disease because they just couldn't stop the spread of these conditions. But they were less likely to die if they got COVID. So what I do think is that for future pandemics, we should be promoting the biodiversity and health of our microbiome systems, because it won't stop a necessary global pandemic like an influenza crisis. They're going to happen. It will just make us more resilient in the face of them. And we should be thinking, when our next kind of pandemic strategy, as we start to plan it, okay, how do we promote and protect our symbionts as part of that strategy?
Really interesting. One of the things that somebody asks, you talk about in the book, you talk about sort of with cooking. For the microbiome. So Shirley says, how much does cooking of vegetables destroy the positive impact on the gut microbiome?
Well, so it's a really interesting question, Shirley. Amazingly, no one really knows for sure. You would have thought. So there have been studies done on it. And the way that I would argue is that it really changes its impact on the microbiome. Whether it's for better or for worse is up for debate, right? So when you take starches and you cook them, you denature them and you turn them into gels, and it changes the physical properties of those fibers in the gut, and it changes also the relationship that the bugs have with those fibers. So actually, we would argue quite strongly that how you cook your food is very, very important. Now, first of all, cook it yourself. So take your delivery up and just chuck it out. Like, you've got to cook your food yourself. And probably what's more important is you've got to share your food. So when you're eating socially with other people, that's how you're sharing your good microbes, which you really need. But cooking absolutely does change the microbiome. Interestingly, like, we know that in some of our patients, we put them on something called an enteral diet, which means that they have a liquid diet. It's only the essential minerals that they get on the essential elements of their food, and they drink it. And that has a profound effect on the microbiome. And much of the benefit that comes from those nutritional strategies is mediated by bugs that change within the gut. So these strategies don't just switch on genes within the gut that have a human benefit. They change the whole ecology of the gut in quite sophisticated ways that actually, the truth is, we're still working out.
So another question that's really interesting is from Emily. Hi, James. In my experience, GPs and specialists often prefer prescription drugs like NSAIDs and other painkillers over diet and lifestyle changes. One part that I sort of flagged up in your book that sort of I find heartbreaking is you say hospitals don't feed the microbiome. So it's incredibly refreshing talking to you in your overalls and hearing you talk like this. But Emily is right. There's still vast swathes of the medical profession who aren't really feel like they're not in the know?
I think that's a fair question, and I would agree with you. And I think, in fairness to lots of my colleagues, part of it is because this is not part of their education. This is not something that they're taught at medical school or you're taught in as part of your clinical career. The second reason is because beyond making general recommendations, we don't have really good clinical tools that allow us to selectively target particular nutritional strategies and approaches for particular clinical conditions, right? So we just don't have that. Like probiotics is a brilliant example. Like, which probiotic should I give? Most doctors just don't know, and it's kind of not their fault. But having said that, I spend a lot of my clinics doing just that, like doing things which are really not medical. And it's much easier to prescribe a non-steroidal anti-inflammatory than to have a 45-minute consultation about sustainably changing someone's health behavior towards something that's better. So I also have a lot of sympathy for family doctors and GPs who just simply are not equipped to give the time that they need. I do, however, think that's changing. So if you look at the NHS 10-year forward plan that we had and then the 5-year plan, actually, it really focused on prevention. It said we need to be helping people eat healthier and to have the educational tools that they need to access the food that they need. We've also got to make it more affordable, right? It's just not affordable. If the average family will really struggle to eat organic food and to eat, food that's really, really good for them, because it's just much, much cheaper to go to the local, fast food joint. And so as a society, we've also got a bit of a problem to fix there, I think, Emily.
I mean, that is somewhat Faye saying, and it really is probably the biggest problem, isn't it? The cost. Yeah. Faye says, in supporting my son to recover from post-COVID gastric issues, I've realised there's a significant cost, to improve their microbiome. I think this is absolutely true. And as a health professional, Faye says, I feel concerned towards those that cannot afford these types of changes. So how far off is the NHS on supporting these types of interventions? In a similar question, Michelle says, will the NHS ever be able to affordably test your microbiome so you can work with a nutritionist to have a more precise diet? She flags up, you can do this privately. I mean, all of this stuff is only affordable for a small minority of people.
Yeah, absolutely right. And
it's so important.
Yeah, exactly right. So the answer is, well, testing microbiome is really contentious, right? So there are lots of companies out there offering point of care testing for the microbiome, and most of them aren't really very good, and you shouldn't really be doing it. I think it's a waste of money. I don't test mine through those commercial tests. We are starting to work towards creating standards for clinical microbiome testing, and I'm involved in some of those initiatives, and we've got initiatives across Europe. That will come in, but it has to be equitable, affordable, and scalable, and it's really got to be quality assured. And it's actually a harder thing to do than you might think. It is going to happen. I'm absolutely sure of that. It'll just take a little bit more time. I think there are a lot of people out there spending a lot of money on probiotics, typically in like really costly subscription programs, which are not evidence-based and not particularly helpful. And actually, there are other simpler things that you can do to protect your gut, which are more affordable, right? And we talked about fermented foods, but to be honest, most of my patients, I say take kefir. Kefir is super cheap, but you can buy it in any supermarket. And there are lots of problems with kefir, and it only, it's not going to work in everybody. It's not a miracle cure, but it's a more sustainable and affordable choice. Yeah, you're right. We need better education programs. We have to make this a more accessible initiative, and that's the purpose of writing this book. Frankly, is to push it up into the public domain, and to say, look, these things are important, and unless we can influence policymakers to prioritize it, it's very difficult to change it. And
kefir is fine as dairy.
Yeah, well, actually, you can make it in water actually, and there are different type of granules you can make, and dairy's not so bad if you're lactose intolerant. It can ferments out quite a lot of it takes out quite a lot of the lactose, so it's okay. You're not going to harm yourself if you take it. It's a safe thing to take. If you're taking these things, there's a couple of rules. Number one, you've got to take them sustainably. So you've got to take them for at least 4 to 8 weeks, because you need those bugs that are growing to engraft and to live within the gut. So if you just take them every so often, there's no point. It doesn't work. The second thing is that, if you're feeling unwell with it, or you're feeling bloated, don't persevere. It's not working. Stop it. All of those bugs that have blown up within you will die, and you'll feel better. All right. And then the third is, of course, it has to be part of a bigger strategy. Like, you have to be asking yourself, well, okay, what other things can I be doing to promote and improve my health? And how do I do that as part of a bigger kind of program or strategy? And sometimes you do need help from a doctor or dietitian or allied healthcare specialist to do that.
Well, we've come to the end of the hour. Charles says book now on must-read list, and I'm sure many others will feel the same. Thank you so very much. I should say I'm delighted there's so many people have joined us, and if you found it interesting and you want to sort of share this with your friends, this video of the conversation will be on the How To Academy website, but also in not too long, hopefully there'll be a podcast as well that people can listen to, but you can of course go and get the book in the meantime. James, thank you so much for joining us for the last hour, and thank you all very much for signing in.
My pleasure. Thank you so much for having me.